Maybe you're in menopause or postmenopause and things down there just aren't acting like they should. Maybe suddenly you're leaking when you cough or you sneeze, or you don't even know why. You just find yourself leaking. Or maybe sex is starting to feel more painful. Maybe you feel like you're kind of dry down there. Maybe you've heard scary things about estrogen and hormone replacement therapy being terrible. I think that there's a lot of misinformation about the use of vaginal estrogen. My name is Nari Kaur Clemons, and I'm a certified pelvic rehab specialist. We see people a lot who come in and they're in the perimenopause years or the postmenopausal years with new leaking or new incidents of vaginal pain. So let's talk a little bit. First, I just want to address, does it go systemic? Is it going to give you cancer? And these sort of questions. And let's address that first. And then I'll make another video talking about, like, if you don't want to put estrogen in your vagina, what are some options that you can do that will keep you feeling good down there? So first off, it can be the case that initially you will get a microscopic increase in your blood levels of estrogen when you first start taking it. Now let me explain. When there's not enough estrogen in the body, in postmenopausal tissues, the skin, the tissue, the muscle on the inside of the vagina, not the skin, I should say the muscle on the inside of the vagina, when we feel it, it feels very thin. It feels like it's only about as thick as a tissue. And so as a pelvic therapist, when I go inside and palpate, when someone has poorly estrogenized tissues, they feel thin and they feel weak. And often with that, when the person tries to contract their muscles, not that much happens because they're not that robust. The walls are made of a muscular type of layer. And without estrogen, it atrophies. In fact, the name of that condition with poor estrogen is atrophic vaginitis. Literally atrophy. Literally, the muscles are wasting in the vagina. And this is a fact. So what happens is when you first put vaginal estrogen in the vagina, and the tissues are very thin when someone's in a menopausal state, and this also happens with nursing. So if you're nursing your baby a year or two and you're doing pelvic rehab and you're like, why am I not getting stronger? And you haven't had a return of your cycles, it's probably because your estrogen is too low. I'm not going to focus on that in this video though. So as you start to apply the estrogen, what happens is that tissue starts to bulk. So initially, when you put the estrogen in and the tissues are very thin, some of it is going to get across that barrier because it's so thin, like a tissue, literally like a Kleenex. As you put that in over 2 weeks, and generally people initially will use it at a higher frequency. So either daily for the first 2 weeks or 5 times a week for the first 2 weeks is probably how your doctor will choose to prescribe it. Then those walls start to feel like if I were to feel the inside of my cheek. It's a little thicker, there's a little meat to it. You can't feel very fine detail on the other side of the tissue. So if I'm on the outside of my cheek, I can feel that there's some bone on the other side, but I can't clearly palpate the edges of the teeth or the space between the teeth. And it's the same thing. Whereas if I just had a tissue over my teeth and I was feeling it, I could feel everything. As that tissue gets a little thicker after the first 2 weeks, then when you apply the estrogen inside the vagina, it can no longer get across that wall. So what happens is it's just absorbed within the wall. And that's why people tend to use it more for the first 2 weeks, because they use that to boost the thickness, to make it more plump. And then twice a week is enough to maintain it after that. Now, how do we apply it? This is another really big thing. A lot of people are just squirting it in with the applicator and then going about their day. It's actually best to put it in at night. And then at some point the next day, they go to the bathroom and the clump of estrogen falls out. And I always say to my patients, that's like if you bought a really great moisturizing cream or a serum for your skin, and you just put a squirt of it on the corner of your forehead, and you were like, why does my skin over here not look better? Because it didn't get worked into the appropriate tissues. So actually, the best way to apply it is the doctor will probably tell you to apply a certain amount into the applicator. And it's usually about a 1-inch length. So you can take that and then you can squirt it inside, use the amount the doctor tells you, and then you actually want to massage it and really work it into all the walls on the inside, especially the front wall if you're having bladder prolapse and the back wall if you're having rectal prolapse or a rectocele. Then this is a really important thing. You actually want to part the labia and take about a pea size and rub it into the outside of the urethra, up by the clitoris, and around the inner labia. Now you don't want to get it back by the rectum because you don't want to contaminate those tissues back and forth with each other. Why would you do that? Because it has a really important effect on the urethra, and let's talk about that right now. First off, we talked about how it's going to plump the wall. So between the vaginal canal and the bladder, we want that wall plumped so that the bladder is held a little bit better in its neighborhood. If that wall is too thin, the bladder can just move into the vaginal space. So rubbing it into the front wall will thicken that wall. It also will have an effect on the urethra, which is just behind that wall. It will make the urethra plumper. Also, when you rub it into the outside of the urethral meatus, the little opening where your urine comes out, that will take that opening and make it from more of a hollow tube to a plumped tube. It's more filled in. Not only does that keep it closed better so that the urine isn't so likely to leak out, but on top of that, it actually makes the inner walls of the urethra more sticky. We want the walls of the urethra sticky so that it's not so easy for urine to come passing through. There's this really interesting reflex. It's called the urethral dilation reflex. And once a couple of drops of urine get deep inside the urethra, the whole thing opens up until it thinks the bladder is empty, and then it closes back up when the bladder stops contracting. If you don't have good stickiness and closure of the urethra, of the walls, then what can happen is you can actually have that urethral dilation reflex getting triggered. So some of you will come in and you'll say, I don't know what happens. Sometimes I can hold my urine. Sometimes it seems like I start to leak and then my whole bladder empties and I'm like left with wet pants and I'm mortified. That's because a urethral dilation reflex got kicked in. And so the estrogen is going to help that. I kind of think of it like a regular straw versus if the opening in the straw was more like a coffee stirrer. The estrogen is going to help that to plump up. The other thing is when our vaginal estrogen gets too low and the tissues start to atrophy, there's a couple other things that can happen. One thing is that when that urethra is left more open, it's more easy for bacteria to get inside that urethra and up into the urethra itself or all the way up into the bladder if it's moving up that way. That's going to create a urinary tract infection. So that urethra being more closed is a really great protection for you. The other thing is there's a couple of conditions that can be made more likely when the vagina doesn't have enough estrogen. So one of those is this condition called Lichen sclerosis. Lichen sclerosis is a scarring condition that kind of scars down the tissue of the vagina, and it can scar down the opening and make it tight. It can scar down the clitoris so it doesn't have good reaction and good function. And then in time, if left too long, it can even start to close up the urethra. And there's a whole host of problems that come with it. But if you're someone who's postmenopausal and you have that, they actually will treat you with estrogen first because low hormone is a precursor for some of these other conditions. To learn more about your vaginal and pelvic health, more tips and tricks to keep yourself functioning your best, go ahead and follow me for more information. Bye.